Good morning, everyone. Welcome to the first, and I hope the last, but maybe not, televised Board of Director meeting. You're looking at the Regency Oaks Resident Organization Council. This is your Board of Directors and your Executive Director, and we're here this morning to let you in on what happens at a board meeting. And we're going to do so by asking a series of questions that we hope will help clarify the status in all of our lives as we go through this pandemic for the coronavirus. Tough times for all of us, because you're stuck in your beautiful apartment. We all are. We get out now and then, but not much. But we're tough people. And we're going to get through all this together, and we just have to stick it out. The end is in sight, I believe, and I would ask you all to continue to be strong and supportive of all of the great policies that Fran is putting out to protect us and make sure that we stay safe and healthy. Grant, you had some things you wanted to lead off.
So, good morning and thank you, John. I thought we'd maybe start by looking at the numbers and just like we normally do, take a look at how things look on a state and local level. Here in the state, it was a tough night. We went up nearly 600 cases overnight to 21,019, and our death count is now up to 511. In Pinellas County, we seem to be flattening the curve, and things actually look good in Pinellas County. Yesterday, we had 479 cases, and this morning we had 494. That's an increase of only 15. That's significant because we have seen 3 consecutive days where the number of new cases presenting at hospital have declined. So we continue to track that number and believe that that is a good early indicator of the curve perhaps flattening in Pinellas County. Our death toll here in the county is at 14. Pasco County continues to be pretty stable at 177 cases and 3 fatalities. It was a tough day for the United States in terms of the count. We went up to 608,000 with 26,000 deaths. The most significant thing that caused that nearly 3,000 increase in the number of new cases relates to the way the city of New Orleans, the city of New Orleans and New York City is accounting for suspected deaths prior to this day. So those individuals over the last 30 days who had expired at home or went to the hospital for end-of-life care but were not tested, those deaths had been counted as suspicious but not technically put in the COVID-19 tally. Yesterday, those 2 hotspots added those fatalities, and it really caused a bump in the numbers. In looking here at Pinellas County, if we look at our specific zip code, it remains at 15 cases in our county, and to date in Pinellas County there have only been 96 hospitalizations. Really amazing numbers when you think about 479 cases, and out of that only 92 resulting in hospitalization. So encouraging numbers. We'll continue to watch and to monitor. In terms of quarantines here at the community, there are 6 residents currently being quarantined. 1 resident is resident 0 and a spouse, and the other 4 residents are recent hospitalizations, and our standard protocol is if you go out to hospital and are returned to the community, whether you are negative or positive for COVID-19, you go on a 14-day isolation with monitoring by our wellness nurse. So those 6 that we are monitoring, not all of them are COVID positive, but we're taking that extra step to ensure that we're on top of this and not bringing the disease back from medical institutions where they're really having a difficult time in controlling that. There are no staff currently being quarantined, and in terms of individuals showing COVID-19 or flu-like symptoms, we're tracking 1 resident and 1 staff member, both presented with low-grade fevers. My staff member is off campus, has not been on campus for 5 days, seems to be recovering, but will complete the quarantine before we allow that individual back. And then the 1 resident that we're tracking, her fever has broken and she's showing no other symptoms. So again, that's an area that looks positive. One of the things that we were thinking about in our meeting yesterday is we said, how is Regency Oaks doing? Yes, we have our first COVID case, but how does that compare to what's happening within Pinellas County? We already know that Pinellas County is doing really well in terms of the number of cases. It's a very low number compared to Hillsborough and other counties. If you were to take the percentage of infection rate to the population, we have over 1 million people, about 500 people in Pinellas County who have gotten COVID. The infection rate is about 2.6% to the overall population. And then you do the math and apply it down to Regency Oaks. If Regency Oaks, even though we have a more frail population, if we were to experience that same infection rate, by rights, we should have between 11 and 12 COVID-19 positives. So in relation to a broader comparison, we seem to be doing really well, and the protocols that we have put in place following CDC guidelines and working with the Department of Health is really reaping dividends for our residents in terms of keeping them safe. The next thing that I wanted to share is the one area that we were looking at after having our first positive COVID test is whether we needed to take additional measures to further protect the residents. And there are a couple of things we decided against and a couple of things that we decided would benefit the residents, and I wanted to share that with you. One of the things we were looking at was shutting the front gates, putting a tent out at the front gate, blocking the exit, having a staff member there 24/7 to track and monitor individuals who were coming on property. We still are struggling with trying to prevent families from coming and visiting with their loved ones on front porches, or we've seen cars sort of hiding out back in the garden area out of our view. We have decided against taking that further measure. It's primarily because of this fact. We track on a daily basis the number of people who leave the community and come back. So I'm not talking about those people who go out and walk the perimeter road. I'm talking about actually leaving the community and coming back. And in the north building, pardon me, our average has been about 19 people a day. And in the south building, it's at 22%. So that means nearly 9% of our resident population are not following the stay-at-home orders. And so one of the things that we wanted to do is we didn't think we needed to completely shut down the campus, because nearly 91% of the residents are doing their best to stay here and not expose their friends and neighbors. But we did want to take an additional step for those who are leaving the campus. So starting tomorrow, when you return to campus, there will be an additional form for you to fill out, and it's pretty extensive. It asks, where did you go? What was the purpose of your visit? It gives you we don't need precise details, but I went out to a doctor's appointment. I went out for grocery shopping. I went out just to ride around and get out of the apartment. All of that information we're going to try to track, because if we can get a handle on where you're going and what you're doing, we'll have a much better opportunity of being able to track social travel and again, make sure that you're not unduly exposing residents at Regency Oaks to the virus. So that is one of the changes we are going to make. One of the second change that we have elected to make is we are going to discontinue all housekeeping services into your apartment, with the exception of linen services. And so we had been going back and forth. One week we would go in and disinfect the toilets. The next week we would go in and take care of floor care. We're going to discontinue both of those services and only go with the linen replacement and the making of your beds. The reason for that is every opportunity we have to reduce the number of people who are in your apartment protects you better and protects the staff better, and it prevents the spread of the virus from one apartment to the other. The biggest fear we have as a community is that a staff member who enters one apartment contracts the disease will then carry it to the next apartment. And it's not going to be the mop or the broom or the vacuum cleaner. It's going to be that person-to-person contact of air droplets picked up in one apartment and carried to the next. So we think this is a necessary step. We will reevaluate it in 10 to 14 days and see where we are. The one last thing that I think I wanted to share this morning is the question that everyone asks me all the time is, Brant, when do you think this is going to end? Is this going to go on forever? They were talking about the cruise industry not reopening till September, the NFL not holding any games until maybe November. And I have a more optimistic view. I want you to remain cautious and continue to practice good social distancing. But I do have a more optimistic view of this. In looking at the downward trend in the number of cases here in Pinellas County, and if you follow the Department of Health looking forward projections, so after the peak on the 21st, we'll see a gradual decline in the curve, and we will be on our way to having beat this virus. So that concludes the numbers update, and I'll turn it back to Don.
Thank you, Brant. Your board represents you. Your board represents all of our residents, and we're here to try to answer your questions. And that's what we're going to try to do. We're going to start off by just asking each one of the board members to ask a question they think is paramount on the residents' mind. And I'll start with one of my favorite board members, Mary Ellen Garner. Mary Ellen, please lead off.
Good morning, good afternoon. I wanted to start off with a statement because I want everybody to know how thankful all of us are for everything everybody's doing, staff and residents. My husband has had Hodgkin's lymphoma and then heart issues. We've been social distancing for 18 months, so it's not new for us, but it's new for most of you. And I wanted to thank you for all your efforts and ask anybody who has not been doing it to please consider doing it. My mother is in the North Building. She's 100. She has some health issues. And I really appreciate all the efforts that everybody is making to help us with the issues that we have. I think a lot of people here have some health issues and would be very grateful to everyone else who does not, to understand that they could give this virus to them just by not social distancing. 2 areas that I noticed was in the mailroom and then in the breezeway. But the mailroom especially, if there's 1 or 2 people in there, just wait before you go in and let everybody get their mail but not be all crammed in together. I haven't been out much except for my husband and my mother, so I don't have many of your questions. So I think mine was more of a statement. Thank you, Don.
Okay, Mary Ellen. Chris, how are you this morning?
I'm good.
Good. Speak up, young man.
Okay.
You're not bashful.
I'd have to second what Mary Ellen said, that the staff and the residents have been doing overall a very, very good job. But I've had a couple of questions that I've run into from residents. One is, when housekeeping is in your apartment, should they wear a mask, the resident? And also, I know one resident does not have a mask. She wanted to know where she could get one. And she was at the front desk, and they don't have them there, obviously. But that would, and I don't have an answer for that either.
Those are 2 great questions, Chris. Thank you. I don't have the answer to either one of them, of course, but I'll pass it over to my friend Brant.
So thank you, Chris. I'll take a stab at that.
Brad,
So,
would you also answer at the same time, does housekeeping change gloves in between rooms?
So let's talk about masks. And I know that there's been a change in the CDC recommendation that you should wear a mask. My interpretation of that is it is primarily because they were having such a hard time getting people who were showing symptoms, who were ill, who were coughing or sneezing from going out in the public and continuing that behavior. A mask is only effective if you have symptoms, are coughing or sneezing. That's technically the only time you need to wear it. If you have on your mask and someone coughs in your face, you're still going to absorb it through your eyes, through your skin. It's surface contamination, and your skin is a very good conductor. A mask is truly only effective for those of you who are showing symptoms, are coughing or sneezing. Masks are very difficult to get. All supplies for this pandemic are hard to find. Masks, gowns, face shields, hand sanitizers. There is a limited number of stock. I have probably ordered 5,000 masks from different sources around the globe. I've gotten in about 400. In our healthcare center, any single patient on quarantine will go through 29 change-outs on a single day. So masks are hard to find, and they are they're not plentiful. In terms of our housekeepers, the one other thing I would add is housekeepers are changing gloves between apartments. Additionally, the people who take the sheets off the bed are not the people who put the new sheets back on the bed. And so we did that because that's the proper cross-contamination protocol set up by CDC. Great question.
Brett, you raised a point in your remarks that you're, in a sense, cutting back on the amount of services housekeeping is going to be providing. And your explanation was you want to minimize the amount of time that the housekeeping people will be in the apartments. Yet, from the moment that person walks in to change the sheets, you are actually, the exposure has taken place. Aren't we, by not having the apartments cleaned, preventing or providing other germs, et cetera, to take place in some of these apartments? Could you think about this a little bit?
So, Lou, good point. And it is true that coronavirus can be passed from surface to surface. Touching a newspaper, touching a countertop, touching a doorknob, but it is a very small percentage of the cases where that is how the disease is caught or passed to another person. This is at its heart, like every other coronavirus that has ever existed. It is a person-to-person transmission. It is an airborne disease. It is passed through coughing, sneezing, and touching. And those are the primary things we are trying to prevent. One of the reasons that we are stopping the vacuuming of the apartments is because the very action of vacuuming takes the carpet fibers where contaminants might live and throws them up into the air. One of the interesting stories that I recently heard was the Senator Rand Paul from Kentucky, who had coronavirus. He caught it attending a conference with 1,000 people. And there was a single person in the room who was infected, and the senator remembers that he didn't get anywhere near this person. He never got closer than 50 feet. He remembered her coughing and sneezing and thought that was annoying, but he never figured he had been exposed. But what happened is those droplets got caught up in the air conditioning and vent system, spread throughout the room, and they literally had a couple of dozen people infected, even though she was not in close proximity to more than a couple. And so those are the reasons we're trying to make sure that we limit the type of behaviors we're doing in your apartment.
You mentioned the fact about the mask. It doesn't help when someone else coughs on you, but it does help you from touching your face. If you touch a doorknob and then you want to scratch your nose, you're going to scratch the outside of the mask. So I think that helps with preventing the spread.
So far, great discussion. We're going to continue this great discussion. I'm going to ask my friend Harry Coble to come up online, please.
Good morning, everyone. I hope you had a good night. I echo my comments what Mary Ellen said. The staff is doing a wonderful job. The one concern that I have is the isolation of a lot of people that have no family here. I know Mary Ellen suggested we do, I call them buddy checks, to see what was going on. Some of them says, well, I need this, I need that. Well, I went out and I tried to help them, but then Brant shut that down. So we need to know if people who has no one here, no family, not able to leave the apartment, how can they get like simple stuff like milk, orange juice, maybe some other little staples they need, because it's very important. And not only that, I would encourage each resident to pick someone once, two or three times a week and call them and just encourage them, because we all need encouragement and we need all to pray for each other. God bless you all.
So thank you, Harry, and the idea of buddy checks, I really think that would be a great addition to our response. I sometimes wonder if the isolation and the impact on what happens with the lack of socialization isn't maybe worse than the pandemic itself. And so having a buddy, someone who cares about you and could check on you on a regular basis, that's a great idea. And I'd encourage all of the residents to, if you know of a friend or a neighbor who is isolated and doesn't have family that's calling and checking in on them, reach out and make a new friend. That's an excellent idea. In terms of basic supplies, whether you need to go to the pharmacy and pick up a script, or if you need to get groceries, basic groceries, there are a couple of different options. Publix does have a delivery program, but we offer something very similar. If you call the front desk, Tuck and Tiffany have set up a grocery store run. We'll send a driver, and whatever supplies you need, we'll go and pick up those supplies, return them to the community, and hand deliver them to your apartment. We'll figure out how to do the billing later, but that service is available, because I know this has been going on for 30 days, and you got to be running out of basics, and so that is something we're able to help you with and get those basic supplies.
Thank you, Brant, and thank you, Harry. Fred, you're up, young man.
Thank you, Don. I have actually a couple questions. One is, I think we need to clarify the procedure that the north residents go through when they go to get a medical test or something in the south building. Be sure that they understand that that is possible. And the second one is, we still have husbands and wives who travel together. The husband is frequently the driver. The wife, for instance, goes to a doctor's office for an appointment. If the husband sits in the car and never gets out from the time he gets in here and then gets back here, does he have to report in and fill out the questionnaire?
So thank you, Fred. And yes, let me clarify the north-south cross-contamination between the two buildings. What we're trying to do is limit the number of people who are going from one building to the other. And it just is an additional step to help make sure that if there is a containment approach in place, disease or virus from one building isn't going to be transmitted to the second. The obvious exception to that is if you are going to the south building for a medical appointment, to have your blood drawn, or to meet with a physician, please feel free to go through those signs. But if I can cut down 95% of the travel between the two buildings, all of us will benefit from that. In terms of accompanying someone outside the community and coming back even though you never left the car, that is still valuable information for us to have, because at least at that point we know you haven't exposed yourself and that you are 100% safe in returning to the community. If we were not to ask that question, we would not have the answer to that. So even though it's going to be a burden for people who leave the community to have to come back and take that additional safety measure, we still believe that tracking movement is critical for us to being able to identify and control the exposure to our resident population base.
Fred, thank you, Brant. There's a mask lady down here. Is that Jean Beagle behind that blue mask?
Hello, everyone. I want you to know the mask is not very comfortable. And if you look around at the board members here, you'll notice that only the 3 women are the ones wearing the mask. Either we're very protective, which is a woman's prerogative, or we touch our faces a lot more often than the men do to assure that our hair is in place, our lipstick is on, and we don't have to blow our nose. I would like to talk a little bit about the food. Thank God for Ricky and the dining crew. They're doing a superb job. But I have some questions about that. First of all, I love the fact that they're coming to our door with the food, but I don't like the fact that sometimes they knock and leave real quick, and you almost have to run down the hallway to get your coffee or your milk. I'm sure that I'm not the only one who has had this happen to them, and it becomes very frustrating. I'm thinking that there's other questions that people might have about dining. I mean, let's face it, we missed the left side of the menu, but we did get a hamburger and we did get a hot dog, or we will, and we've gotten salmon. So what I would like to propose is that Margaret Hendry is the board member in charge of the dining committee. And I already gave her a list a couple weeks ago after we had a conference call board meeting that was not televised. And Margaret took those questions that I had and either emailed or phoned and talked to Ricky, and he'll talk to her because she's the chairperson. He may not want to answer your phone calls or answer your email. So if Margaret is willing in the south building, and I know I would be willing in the north building, if any of you have questions about the dining and you would like to see an answer to it, if you would either email me or put a note in my mailbox, and do the same in the south building for Margaret. And we would see that Ricky would get answers to these questions. For instance, I know that when the wine cart came around, everybody who drank wine was real happy, but those of us who don't drink wine could have used a Coke or a beer. And I understand he's going to do that the next time the wine cart comes around. I would like to ask Brant, if this is already happening and I don't know it, or if it's a possibility. A number of the board members have said that they've talked to a resident who has asked them this question. I don't really talk to other residents. I get my mail at midnight, 3 days a week. And I take my recycles down then, my newspaper down then. So would it be possible if we had a question box somewhere near the front desk or even in the mailroom where people could write down a question they might have, and then that could get to Brant so he could add those questions to his weekly talks? And the other suggestion that I have, and I don't know who this really involves, but this is with communication. We keep announcing we're going to have the talks at 12:30, 3:30, and 5:30. And some people who don't watch Channel 732 a lot during the day, they'll put their TV on or the channel on at that time, but it doesn't come on. I do know that at nighttime, you loop the talk, because I've been down in the lobby at midnight and even in my apartment, and I see the talk keep looping through. So maybe there's a way that could be done several times during the day, or maybe we don't want to announce watch it at 12:30, 3:30, and 5:30 if it's not going to air. So I would like to know if Brant could talk to the rest of the administrators about that, or if he wants to address it today.
So thank you, Jean, for those series of questions. And I think it's interesting to note this morning on the way into work, I was listening to a radio program, and they were talking about 7 of the 10 countries in the world that the top 10 countries in the world in terms of fighting this virus and controlling the number, they were all led by women. So maybe there's some truth in those numbers. In terms of the food, I'm so proud of Ricky and the dining services team. It's amazing to think about what they're doing and being able to get that quantity of food out to the residents in a single serving, enough to nutritionally take care of you for the day, and to do it with as few errors as they have been able to accomplish that. So we're really proud of what they have been able to accomplish. It's an ongoing process. We're always looking for improvement. We will look forward to hearing some suggestions and feedback directly back from Eugene and from Margaret Henry. The one thing I maybe will talk about there are a couple of things that have happened since Monday, and we're telling the young servers to go to a knock and drop delivery. And so we, and this quite honestly was a little bit of overstepping by our dining services in an effort to make sure you're safe. They were trying to limit the amount of social interaction, and so adopted a knock and drop. I think you may have, I hope that you have seen some improvement yesterday afternoon and hopefully today. There is also a change in the way that they are going to be distributing coffee. That's the key component to get you up and going, and so they have a new enhancement that they'll be starting today, and I hope we get some good feedback on that. The question idea is a tremendous idea, and although we do not have a suggestion box, we are encouraging residents to contact the front desk with any questions that they might have. You perhaps have noticed that the 5 Thoughts format this week has changed to a Q&A format. And the reason for that is we were getting so many questions. So every day I'm trying to address 5 questions and provide you with good information or an update. So that's a tremendous suggestion. And then in terms of the actual daily COVID task force production that we're airing on the TV. You know, when we first did this, I look back at our first production, it was like 12 minutes long, and now we're getting up to an hour. And so Tiffany, who is our editor, producer, director, filmmaker, she does it all. It is difficult for her if our meeting runs an hour to make that 12:30 deadline. She has a lot of editing and production work in order to get a quality product up on the TV. So we're running into some difficulties in meeting that initial time frame. Here's the way I think we can start to think about this, is immediately before the movie, we will do the COVID update. It will be followed by the movie. Immediately after the movie, you will be able to catch the COVID update. Tiffany usually will play it a couple of different times, and then in off hours, overnight between 5 and the evening movie, we loop it, and so you'll be able to catch it just one time right after another, because I know it is riveting TV.
Okay, let's go down to the most distinguished board member we have, senior citizen, Don Hamilton. Morning, Don.
Good morning, Don. Good morning. I have a great group of directors around me that have asked virtually all the questions that I have. I too support all the hard work that's been done by the serving staff and by the housekeeping department. I think we're doing a tremendous job. And they've pretty much covered all of the questions that I had learned and had heard from fellow residents. I think we're very fortunate to be in Regency Oaks and to be so well taken care of.
Okay, well, thank you, Don. I'd like to introduce Margaret Henry, who's in charge of our dining, as you know. And Margaret, would you take over, please?
Greetings, fellow residents. I just want to address some of the things with dining. You have to realize that Ricky has an unusual situation where he's trying to get 3 meals out a day in limited space with limited people. So even though we would like things to be a little bit different, he is working within his parameters. And thank you for your patience, and thank you to Ricky and the whole staff for everything they've done. One of the questions that has come up is, I don't particularly care for my food on the floor when it's delivered. If you have a TV table, a end table you're not using, put it outside your door, and then you will not have to bend over and it will not be on the ground. If you need help getting a table out, ask a neighbor or ask at the front desk and we'll get somebody to help you. That is dining. I do have some other questions. Several residents have come to me and said, my family will pick up prescriptions and toilet paper and tissue for me. How do I get that from them? They used to drop it off at the front desk and then they were told they couldn't do that. Is it okay if I go to the parking lot and pick it up from their car? What procedure should I do to get things from my family? Another question has to do with the beauty shop. There is a yin and yang having to do with the beauty shop. People need their hair cut and people are concerned about sharing germs in the beauty shop. That's my question, thank you.
Okay, thank you, Margaret. In terms of having families bring in basic supplies or medications, the correct procedure is to bring it into the front desk, drop it off, and we will hand deliver it. It is not a good practice for you to go outside and interact with your family. And if you order a pizza at home, the way they are working that now is the pizza guy comes, he puts it on the ground, he steps away from it, and then leaves. Unfortunately, with our families, we tend not to do that because they're our loved ones. We show affection, and the first thing that we observe is a hug, a handshake, and just it's natural. And it's not that people intentionally do it; it's that it's ingrained. It's a routine, and so that's why we're trying to limit the exposure to our family members. Our family members are out in a broader community. We're not tracking their temps, and we don't know what threat they pose to either you as an individual or the community as a whole. So that is the correct procedure. In terms of the beauty shop, here is why we are still allowing the beautician to continue her work. It's a small group setting. She knows that she can have no more than 4 people in the beauty shop at any given time. It's one-on-one, and our beautician, just like every other staff member, we have been tracking her temperature, and we have that information logged for over nearly 30 days now. The single most important tool that we have in determining and controlling the spread of this disease is the day-over-day temperature readings that we do on at-risk residents and all of our staff. And so it gives us that early indicator that someone's temperature is gradually increasing, and we can quarantine before they get into the viral shedding, where that is where coronavirus is passed.
Distinguished senior member, the great Lou. Good morning, Lou.
As the senior citizen of this group, the thing I've always heard about Regency Oaks, I hear people say, is that the best thing about this place is the people. And what I'm seeing is it's the people that is making this thing, and it's the people that will make this thing work. What I've been trying to do is each day call somebody up. And I'd like to suggest to all of you, call somebody up, not necessarily a friend, but somebody you've met in bingo, exercise class. They're not necessarily your best friend, but just somebody. Call one person, maybe 2, 3 a day. And I think that will help a lot of people. I truly believe what somebody said here today. The biggest problem is the feeling of isolation. And I think that will help. And somebody mentioned the buddy system. I think that's a good idea. But call somebody up today and say hello. That's all I have. Thank you.
Okay, there you have it. You've seen the inside of a board of directors meeting, and we hope we've answered most of your questions. If you have questions, the thing to do is just email me, email any of the board members, call any of the board members, email any of them. But get your questions into us and we'll make sure they get to Brad. So we hope you found that this to be an interesting session. It's a tough time, but we're tough people. We're gonna get through it. We're gonna do it as a team. We're gonna do it together. Okay, thank you all very much.